Hello everyone. A warm welcome to this first panel session on global lessons for AI in healthcare. Delighted to be joined by an illustrious panel. Before I introduce those though, we're keen to get you on Slido, which is how we want people to submit questions for this session. So we thought we'd start with an audience poll, just a bit of fun. We're going to ask you which of these two statements comes closer to your view. We're currently underestimating how much AI will change healthcare. It could revolutionise services. Or we're currently overestimating how much AI will change healthcare. There's too much hype. And look, while we've been talking, the results have been coming in. And they're more finely balanced than I thought, but on balance, we are believing in the revolutionary potential of AI in healthcare. And I guess it's the size of that prize that has got health systems around the world mobilising to see how they could realise the potential benefits of AI. A year ago at this summit, the Health Foundation called for a dedicated strategy for AI in healthcare. And it's been really interesting to see over the last year how this agenda's developed. We had the AI Opportunities Action Plan in January, followed in July by the 10-year health plan for England, which had some ambitious commitments on AI, including, as we just heard from the Minister earlier, a commitment to develop an AI strategic roadmap for the NHS. Over the last 12 months at the Foundation, we've been talking to colleagues in health systems around the world, and probably won't surprise you to know that they're all grappling with similar sets of challenges. How do you regulate AI? How do you implement and scale it? How do you develop your workforce? How do you engage with the public? So we thought today was the perfect opportunity to bring some friends and colleagues together to compare notes and see how it's going. And to do that, I'm delighted to be joined by, first of all, Dr. Alec Price-Forbes, National Chief Clinical Information Officer for NHS England and a practicing consultant rheumatologist. Hilde, Lovett, a special advisor at the Norwegian Directorate of Health, who oversees their plan for AI in health and care services. Dr. Joan Guanyabens, Director of the Salut Social Foundation, which is the public body charged with overseeing digital transformation in the Catalan health service. And Karl-Henrik Peterson, Interim Chief Executive of the Estonian Health Insurance Fund, as well as an advisor to the Estonian Academy of Sciences on AI. So could we start just by joining me in giving them a warm welcome? Alec, let me come to you first. How would you characterise where we are at the moment in England, and what are the priorities on your radar for our AI strategy?
Brilliant. Okay, well, first of all, thank you, Tim, for the introduction. Good afternoon, everyone. Thanks for the opportunity, and thank you for having me. Really good to be here. So, as Tim said, I'm still a practicing rheumatologist, a chronic disease specialist. I spent all day yesterday, 2 face-to-face clinics plus an evening clinic, and therefore I'm scarred with the challenges that our current workforce have using the current best of technology. That sometimes feels like rather than talking to our patients, we're spending more time tip-tapping, looking at a computer. But leaving aside that, I've spent most of my time as National CCIO in NHS England. It's a real pleasure to be here amongst colleagues from Europe and wider afield. And it reminds me, I'm lucky enough really to be reminded every day working in the NHS, the enormous international talent that underpins everything that we do. So as you alluded to, across systems globally, we're all facing the similar pressures, a growing demand, an ageing population with healthy life expectancy now lagging significantly behind life expectancy, so people living with chronic multi-morbidity for longer, constrained resources, both in terms of workforce and funding, and rising expectations from our patients and staff. And it's striking how universal these challenges are, and I'm sure we'll hear more from our colleagues in Norway, Estonia and Catalonia about that shortly. But what is equally clear is that AI now offers a practical tool to help address many of these in ways that simply weren't possible a few years ago. And Minister Ahmed and Lawrence have alluded to that already. And I'm really looking forward to hearing from our colleagues here today on how they're approaching such opportunities. The challenges we face do not stop at our national borders, and our efforts to meet and find solutions shouldn't either. So let me practice what I'm preaching and talk about really the AI and the position where I think we find ourselves now in the NHS. We're already seeing examples of how AI can support clinicians, patients, operational teams, from diagnostics, from drug discovery and development, through to back office administrative processes. AI is really helping free up time and improve accuracy of data that is collected. But of course, we've had challenges too. How could we not, with AI moving so fast and systems that were designed for a very different world? But sharing those lessons openly is one of the key reasons that international collaboration is so valuable. And we really need to hear from others about the issues that they're facing and how they found solutions as they've worked through them. This work connects closely to a wider piece now underway, as you've alluded to, and the Minister announced the new AI strategic roadmap for the NHS and adult social care. That's being led by my colleagues in the room, Dom Cushnan, Laura Harkins and others who are doing an amazing and outstanding job bringing together insight from across the system. The roadmap will not be a high-level document, a glossy document that sits on a shelf. No, it will set out clear, practical direction of travel, describing our priorities, the sequencing of activity that we need to do, and the enabling conditions required to measure success. It's designed to evolve over time, reflecting lessons from implementation and inevitable changes in the new era of AI that we find ourselves in. We've already started early engagement through the AI Ambassadors Network. That Ambassadors Network was a dedicated space Dom and the team set up earlier this year to support learning, capability building and delivery of AI across health and care systems. There's over 10,000 members now, with 2,000 people joining calls every month. And that's going to be the workforce, the collaborative effort that we're going to need if we're going to move progress things forward. And that regular engagement, really going from 0 members in January to 10,000, is going to ensure that the roadmap reflects the realities of people on the ground across NHS organisations, those within it, as well as the perspectives of technology providers. We're also looking outward to draw on international experience, whether that's from a regulatory and governance approach, as well as around implementation, blueprints, and evaluation models. The success of AI in health and care depends on far more than the technology itself. It requires strong digital foundations, the right governance, and above all, cultural change. Technology doesn't heal, people do. And the greatest innovation we have right now is not just artificial intelligence, it's human intelligence. It's about empathy, compassion, and embracing new ways of working and change when it means providing high quality, safe services to transform people's lives. So we need to support our staff to be able to work differently, to ensure systems and data is interoperable, build public confidence and maintain trust that AI is being used both safely and responsibly. That transformation is complex. It's an area where we've shared learning already across borders, and we know it can make a real difference. An international collaboration with colleagues here allow us to avoid repeating the same mistakes, to adapt what's already working, and to align on standards that make interoperability itself and easier from the start. So I'd particularly welcome what we're going to hear in this conversation about practical next steps, whether that's joint evaluation frameworks, shared learning networks, or collaborative research and innovation programs. So looking forward to the conversation. Thanks, Tim.
Many thanks, Alec. Hilde, let me come on to you. In Norway, you had put your AI plan in place a year ago. So I'm keen to find out what progress have you made and what are you focused on now? And I know what you're going to ask. You're going to need the clicker to move the slides on. So let me serve that up.
Automatically.
Yep.
Yeah, thank you. And thank you very much for inviting us here. Does it work? Yeah, okay. Thank you for inviting us to share, as you said, share notes, experiences, etc. That's very nice. I thought I would tell a little bit about our journey, the last sort of 5, 6, 7 years, and it of course started in the 2019 with a previous wave of AI, which was the predictive AI, where we had already in our national health and care hospital plan ambitions about how AI could augment to be better health and care services, better research, and better use of the resources. And we then started with the more administrative work optimization of something, of personnel, use of personnel, use of the operating rooms, use of the, how could you get fastest from one place to another, etc. Quite low risk, high value applications. And then after some years, we started then to implement image recognition, and we started with radiology. So even if it was on the plan in 2019, in 2023, the first implementation was actually done. But then after that, in one hospital. But after that, it was soon rolled out in more hospitals in the same region, and then across and different more regions in Norway. So now you can go to the emergency unit. If you're afraid if you're having a fracture, you have an AI that can say, if the probability is high that you don't have a fracture, then you can be sent home. But it's always a radiologist that reads these images within 24 hours. So it's not automatically yet. And then we are looking into more modalities and more clinical areas. For example, mammography, or also in diabetic retinopathy. I can't explain.
Diabetic retinopathy.
Eye diseases for people with diabetic diseases. Yes, sorry about that. So we are into more areas, experimenting with that, but it takes time. But it is getting faster and faster into practice. But then we have some other reports, and they were more focused on resources and making use of the resources in a better way, in a way. And then we had also, we are concerned with how can the health personnel work more efficiently, and also how can the citizens be more able to take care of their own health. And at the same time came along generative AI. And of course that took much faster time to adopt. So now doctors are starting to use it, and also to text, voice to text, but also text to, for example, clinical notes.
Yeah.
And come back to that. But we are sort of moving into more difficult regulatory landscape. But there's a great need for that, we see that. And also we are working with public-facing services, so that citizens can also, of course, they are already provided with that, with this open ChatGPT and the other relatives. You can actually already, you can feed into lots of medical information and get quite personalized advices. So that's happened the last years. And but what we've done in the sort of the government side, the municipality, it's to try. I like the wording that guidance is your friend. So we have had a coordination project from 2019, and then it turned out to an action plan, joint action plan, the latest years, and to try to frame and guide and give quite clear guidance on how to implement AI in a safe and effective way in the healthcare services. So, therefore, we have this plan we launched last year, and it's going to be flexible and dynamic because this technology moves very fast. And the goal is to increase use, it's going to be safe use, and the quality should be at least as good as it is today, but preferably better, and also help with efficiency. And then we have work together with all the regions. In Norway, there are 4 regions that are responsible for the special care, the hospitals in Norway. And we also have the municipalities. They are responsible for the GPs, for example. So they are in this board. And we also have all the regulatory offices. They are also part of this board. And they give advice on and prioritize the task that we do. And the task we do is regulatory guidance is the most important. We started back in 2021, I think, cross-agency. We also have a cross-agency information page, landing page. If you are concerned about AI in healthcare, you go to this landing page. We also have, we were inspired by a bias guide to AI, which we made in NHS some years ago. Yeah. And we made another one, we call it for guidance to quality assure the whole process of deciding when to buy, if you're going to buy AI, what are the regulatory requirements, how are we going to prepare the organization, and how are we going to maintain and support this system over time. And we also are into language models, of course, and we are concerned that we also have systems that are able to adapt the services to Norwegian language, the themes or the values and the work processes that are used in the Norwegian health and care services. So we've been doing some reports on that and trying to then, and the most important work for us further on is to make a quality assurance framework so that we are able to quality assure the systems that we are actually going to use and compare the different solutions. Yeah.
Well, look, thanks. There's a lot to get into there.
Yeah, sorry.
And in fact, 3 or 4 questions spring to mind. But before we dive in, I want to come over to Joan. Joan, again, you've had an AI strategy, an AI program in place for a while. How's that going?
Okay. Thank you very much for the invitation. And I will try to share our experience in the strategy around artificial intelligence for health. In 2020, at the onset of the pandemic, the Department of Health of Catalonia asked a key question. Should anything be done with AI? Which at that time meant predictive AI. And if so, what and how should it be done? Okay. Time has provided a clear answer. Yes, there is much to do, and it must be done well. To this end, we created the Health Program AI program, enabling the Health Department to implement AI solutions systematically across the healthcare system. The goal is simple, yet essential: to do more and better with fewer resources. Demand for health services continues to grow while resources remain limited. As part of this strategy, we advised the department to prioritize enabling development rather than developing or owning solutions. This means providing health data for training and evaluation, negotiating usage rights and data sovereignty over AI assets, and focusing on evaluation and deployment rather than pure development. Before acquiring or agreeing to any solution beyond compliance with regulation and certification, it is vital to test and evaluate AI systems with our own data. Over these 5 years, we have learned that we must learn how to negotiate usage rights and data sovereignty over AI solutions. We must learn also how to evaluate these solutions, this technology, in an effective way. And we must learn also how to integrate AI into the clinical practice by adapting workflows, responsibilities, and roles to ensure the active adoption. Catalonia has the assets required to achieve this: a high level of digitization and data quality, with health data covering activity, diagnosis, prescriptions, and monitoring. Essentially, what we have is a draft of digital twins for over 8 million citizen Catalans. Also, we have highly skilled professionals, researchers, and specialists in health and also in technology. And at the end, we have advanced data processing centers now operating as EU-funded AI factories. To date, the program has launched 6 AI challenges with emphasis on primary care and medical imaging. So digital retinopathy, dermatology, chest X-ray, medication chatbot for the citizens and also for the professionals, voice assistant for patient-professional interaction, and stroke detection and management. For each challenge, we first analyze existing market. Don't worry, it's in a loop. Huh? We first analyze existing market solutions and their certifications. And based on the findings, we choose between public-private partnership, joint developments, or the procurement of reliable commercial solutions. Additional milestones include the launch of an AI observatory, training and capacitation of the professionals and the citizens, best practice guidelines, health technology assessment. So we built also a framework specifically to the AA tools, active participation in European projects like Incisive and in the related initiative known as a Future AI, on responsible AI and collaboration with the United Kingdom National Health Service for program review. As a result of this review, now we are looking ahead and we will continue and extending this situation. First, we want to strengthen the governance and extending its reach. Second, we want to monitor European AI regulations, possibly establishing a Catalan notified body. Also, we want to support the deployment of the GRID initiative from Europe, the European Health Data Spaces, with open EHR as a standard. Also, we want to require all the algorithms in use to be registered and monitored in the observatory. And at the end, also, we have to advance in the sustainable business models, ensuring users' rights and data sovereignty.
Thanks, Joan. A very clear overview of that. It sounds like it's going okay, but if you could rewind, if you could go back a year, what would you do differently? What advice would you give to someone starting this journey?
We have learned that it's very, very important from the beginning to put the correct leadership of the initiative. That, in the majority of the projects that we have, that means clinicians at the front of the initiative. Yeah. From the beginning, because they can see all the difficulties that we have to afford, evaluation, adoption, capacitation, etc., to be successful. So this is our recommendation, and we want to move to this clearly.
Okay. So get the leadership right. It's interesting, reflecting a theme we heard from the minister earlier. Karl, let me come to you next. Many countries look at Estonia rather jealously as a country with a high level of digital maturity, interoperability, and digitization. How have you got to that point? What's mattered in doing that, and what are you focused on now?
Thank you, and thanks for the invitation to speak here. So for Estonia, it was quite simple. If you know the book, The New Innovator's Dilemma, then whenever you're changing something these days, you should consider how would you build up the system from zero, from nothing today, as opposed to just trying to change the system to correspond to current capabilities. And when Estonia started digitization, this is where we were. Actually, we had nothing. So it was easy to build up something the way it should be built. And also, I'm not sure if it's good or bad, but our legislation at that time was also running behind that innovation curve. So we got to do things before somebody thought that maybe it's not a good idea. But it turned out okay. But for Estonia, I think in general, all of the things that I have heard here, these are very much core issues for us as well. But we are trying to categorize those topics, let's say, into 4 or 5 categories. First of all, of course, we need to understand for us what is the driving force forcing the change. And it's not that there is technology available. There is probably something else, but I'll talk about that. Then we also need to understand the technology and how do we actually become competent in using that technology, which is really important part. The organizational part, who is the organization and how you structure those organizations so that they're actually able to tackle these technologies, because in the end, those organizations are making those choices about capital allocation, whether it is some sort of government body or a specific government institution. Then we have the sustainability and national security point of view, which is really important considering our eastern neighbor. And of course, last but not least, it's all about governance and regulation that also needs to work with all of this setup. And to be really, really quick about it, just the first part for us is really simple. We are projected to have only half of the population by end of this century. So we are declining in population quite rapidly. We are missing basically half of young people aged under 30 years of age. And what it means for medical field, for example, is that within the next 5 years, we're going to have a third of primary care physicians retire. Third. Some of those young people are taking up family medicine in university, but at the present tempo, we are going to replace this gap over the next 75 years. So that's not going to work. Of course, we are looking for ways to change the roles and so forth, but still the population base will not support people-based solutions so much. And if I talk to startup sector, which is quite vibrant in Estonia and also elsewhere, the primary thing that we are recognizing today is that if you want to get financed as a startup, you need to tell a story about how you're replacing people with AI. And first I was quite taken aback and thinking, oh my God, what are all these people going to do that are going to be replaced by AI? But I think Minister here already mentioned that actually the problem is different. We just don't have those people. We actually do need this AI to replace those unfilled roles. So that is quite clear for us. And Estonian economy in a whole, I think, is all in to deploying AI. There is just no other way to keep present level of services and economy. Then let's talk about additional technology topics. We are rolling out AI-enabled services layer for the government services. And the idea behind it is quite simple, that first of all, these are services that are kind of using AI to deliver those services, but on top of that, they are exposing their APIs for wider use. And if you know how AI-enabled applications are built today and processes and workflows, you have some kind of tool set called, for example, N8N, where you can just take those service borderlines and bring it into your own service and just very fast way build up those new services. And I think with OpenEHR, I heard this is also part of the story, this vibe coding, which is really important. And of course, to enable use of that, we need organizations that are actually capable of doing it. And one of the things that I haven't heard yet here, maybe I should talk about it, is how we are rolling out change in organizational architecture for government services. So we are changing from department-based organizations towards service-oriented organizations. Each service has their own clear value proposal, their own clear customer segment, and the service team is end-to-end responsible for the operations of the service, but also for the innovation within the service space. And I think Estonian Health Insurance Fund is a good example for that, how to do it. We are one of the forerunners. Within the past 2.5 years, we've done this change, which has incorporating also cloud-based technology infrastructure. And now we are able to actually push, let's say, 3 times more innovation through than we used to be able to do. And the point is to actually get this base of innovation as wide as possible, so you get this fast learning cycles and do it this way. And maybe we'll talk about those other topics later. I think they have been taught, but one of the lessons is also really important, that take small steps. You learn, you get more knowledge about what to regulate, what to do, and just as the saying is in business, show me the profit. So we make a small investment, we want to see whether it works or not. And just as an example with these family doctors, a small button that enables this transcription of patient and doctor visit into a visit summary saves easily about 4 minutes per visit. Visit itself is like 20 minutes. So that's, for a very simple solution, really quite good result. And we learn a lot from it, and we are rolling it out at the moment. So cannot speak of statistically significant results yet, but anecdotal evidence is pretty good.
It's interesting. That seems to be the technology that's coming up again and again.
Yeah.
Hilde, are you looking at digital scribes in Norway?
Yes, sure.
Yeah.
We are. We see that the doctors, they want it, so they are quite eager to use it, and they're using it. We don't have the exact numbers, but we believe it's a lot. We are piloting it in the hospitals as well as the GPs. They are sort of starting to use it. Yeah.
Well, really interesting. Before we open up for questions, I want to come back to you, Alec. What are you hearing? Is there anything you're hearing that resonates with you in terms of where we are in England?
I think listening to our colleagues, they've all outlined, but it's all come back to, it's a journey of change, but with people, still humans in the loop. And how do we create that time and space, particularly with a beleaguered workforce that can't deliver against demand at the moment. But it's also, I think there's something for me about reflecting on that we're sort of focusing AI on around productivity and sort of efficiency gains. And there's something about that will reduce cost. But actually, how do you start to move towards an innovative AI approach that's increasing revenue? And I think we heard the Minister talk about a national growth service. So there's something about how we need to sort of take a helicopter view, because there's a lot of AI being used from a point solution perspective to reduce the administrative burden of repetitive tasks. And absolutely, that's the right thing to do. And it's a tactical, low-hanging fruit where you can make really quick yields and gains. But actually, there's a broader bit, which is we need to create an environment, a culture where there's transparency, there's understanding, and we can bring the public as well as the workforce and patients on that journey of discovery, where we can really, truly enhance and make healthcare more human again, but also deliver improved and better outcomes. So there's something about infrastructure. You talked about architecture, I think, at the end. How do we create that enterprise architecture where we've got scalable capability because we've got high quality data? So we've reimagined our digital and data architecture, layering AI in, rather than, so you look at that sort of whole service. I think you talked about services rather than sort of point solutions. When I'm seeing a patient, this is what I'm going to do. Actually, how do you start to look at the end-to-end around patients on journeys across care settings with frailty, with other comorbidities, long-term morbidities like cardiovascular disease? We've got to do the prevention bit, identify, prevent them developing the consequences of cardiovascular disease, premature death from heart attack and stroke, but actually intervene in a more imaginative way, really using digital and data to reimagine. So there's something about a shift really from sort of productivity AI, which is what we're talking about at the moment, towards innovative AI that's really going to really improve the outcomes for people in society.
Yeah. Great. We've had loads of questions come in, and I want to try and take some. One the questioner didn't give their name. How do we build trust in AI tools across both patients and staff to support uptake? Hilde, is that something you're thinking about in Norway?
Yes, a lot, actually.
Tell us more.
Well, it's all about trust, as you say, and it's the difficult thing is actually to assess and evaluate these systems, especially when you talk about generative AI, of course. And it's we haven't yet, for example, published a public-facing generative AI service, because it's difficult to assure that the quality is good enough. And especially if you come from the government or the health services, it's important that you actually have the trust. So that's important to start to to do that, to find the right measurements and evaluations so that you can be sure that this is good enough. So it's a sort of a nut. It's difficult to do that at the time being, but it's very, very important.
Karl, when I look at Estonia, it strikes me that you have a high trust environment there in data and digital and records. How has that been achieved?
I think people are just used to getting value from their data and the services that we provide, and that actually builds trust. We have, of course, outages sometimes like everybody else has. But in the end, if you have clear communication, you are not afraid of testing out new solutions, but you also explain that this is what you should expect, then that kind of tends to build trust. The worst case that you can do is overhype your solution. Then it turns out that it hallucinates, and then you have destroyed basically your trust. So we try to avoid that, but still, why we are, for example, building now these new solutions on our customer or people-facing portal for healthcare is just that we can test out in small chunks that how this or that change actually gets feedback from people. And then if you tune it to actually correspond to those expectations, I think that is the way to go.
And so showing people the value they get.
Show the value.
Yeah. Joan, in terms of transparency, you mentioned the AI observatory that Catalonia has. Say a bit more about that. This is for monitoring AI across the life cycle, yes?
It's for monitoring, but it seems that could be useful to fulfill a European requirement that any citizen has the right to know that the system are using an algorithm to take care of him. So if this is mandatory, we start to build a register in the observatory with all the algorithms that are in use in the Catalan health system as a systemic way. So in this case, the citizen has the trust with the system, can know which is the origin and the validation and the use, and can see what happens with this concrete algorithm. So we are working on this. We start with this not mandatory register, but we attend that in the next month, probably will be mandatory.
Right. Sounds interesting. And can anyone go online and see this observatory?
You can go online and you can see for each algorithm who has validated, who belongs, and who are the use of these algorithms.
That's really interesting. Alec, I want to take another question and come to you. We have a question. Is now really the time we need to upskill our staff? And is this the moment to professionalise all roles, giving confidence that everyone can use AI effectively? I guess that's being asked primarily within the context of the NHS here in England.
Okay, yeah, no, absolutely. A really, really valid question. And I would say it's not just about equipping the workforce with the skills that needed around AI, but around digital data and technology even more so. I think the workforce of the future needs to not just understand medicine and healthcare, but understand so much more around how we use these tools. We know we're in the foothills of digital transformation, and we know that only 11% of staff tell us that they have the sort of equipment and tools to be able to do their job, and for 70% interoperability is a challenge around integrated care. We have a public, it's not just workforce though, we have 7% of the public who don't have the internet, and 10 million people in this country who don't have foundational skills to be able to avail themselves of digital literacy. So there's huge amounts we need to be able to do, not just embedding those skills within workforce, but I would say wider society. This is about the public as well as patients, advocates, and the workforce.
Yeah. Has workforce been a big element of your AI plan, Hilde?
Yes, you could talk about competence.
Yeah.
Yeah, because of course, as somebody said earlier, the risk is also how you use AI. So of course, it's important that you actually learn what it can do and what it cannot do. So that's of course very important.
Yes.
Yeah.
And while I've got you, I was intrigued.
Yeah.
Your plan last year was called a collaboration plan.
Yeah.
I mean, something that many health systems are struggling with is how do you get collaboration within and between sectors?
Mm-hmm.
How do you align agencies on this agenda? Have you cracked that? Was that the board you were talking about? Is that the mechanism for this?
In this case, yes, because the hospitals and the GPs they buy the systems sort of bottom up in a way, but of course then we help to frame it and to guide them, and as I said, yes, we then started quite early with this cross-agency collaboration. And also all the regions in Norway, and then all the or a collaboration of municipalities that actually then cover the services and the regulatory bodies in.
Yeah. Oh, really interesting. Yeah. Let's try and take a couple more questions. On to international guests. What was the level of digital maturity of your providers before you deployed AI? What was your level of digital maturity? Maybe to simplify that, in retrospect, were you ready to deploy AI before you did? Joan.
We have a very good level of maturity in terms of the data. We have practically all the personal health related with health data for the citizens. And this is the main asset to build good solutions. And we are, of course, we don't want to develop as a government, and we don't want the property of the solutions, but it's clear that we want the control of these solutions. So the governance in terms also of the evolution of these solutions. And we will contribute with our data to improve the solutions. So we want that this was taken into account from the companies, from the market. This is our goal at this moment.
Yeah. And Karl, what about you? You talked about those enabling technologies that are underpinning AI. Was that a long journey to get to the point you now
are? Yeah, I think it has been a long journey. For the Estonian Health Insurance Fund, specifically financing the healthcare services, our first deployment was back in 2019. So it's not that long of a journey. We just saw that doing 1% of our bills manually checking them was not kind of a good idea. So we built a trained machine to do that. Now it's doing it. But as far as I mentioned, that we actually have very good cooperation with our private sector. And I think the maturity doesn't come singularly from government side, but it has to cover the whole economy. Not just payer, but also clinicians, private sector. And this building those startups has been kind of core identity for us for quite a long time. So I think in a way we are in a good place, but everything comes with issues as well.
Of course.
People tend to think they know more than they actually do.
It's interesting to hear, though, 2019, that would be, what, a decade after you got your electronic patient record system sorted?
Yes.
Yeah, so interesting to hear that. We've got so many questions, we can't possibly take them all. And in fact, I'm being told we're now at time. So, Alec, I'm going to come to you for a final comment. Just, is there a thought you take away from this, or just a reflection you'd like to share as we draw this to a close?
I think we are, as we've talked about in just that last point, 10 years before you can start doing transformation. We've done a lot of digitising what we did on paper. Now is the time, the call really to action that we heard from Minister, to collaborate together. I mean, what we do needs to be, and particularly when it comes to AI, but all digital solutions need to be safe, assured, and deliver proven benefit. But most importantly, we've got to bring people on that journey, and that journey is public, patients, as well as the workforce, to truly implement, have a gold standard methodology for implementation, which leads to benefit creation and value creation, so that we can start to collaborate together and create a really good sort of feedback loop around process, platforms, data, technology, and people, to create that sort of flywheel effect where we're truly innovating and creating a new culture of change and value creation. And that will create the growth mission and improve people's lives.
Right. Oh, well, it'll be, we'll all be watching as that roadmap comes out. Let's see how we make progress towards that. Brilliant. Well, look, heading into the break, it just remains for me to thank our panel, Alec Price-Forbes, Hilde Lovett, Joan Guanyabens, and Karl-Henrik Peterson. Thank you.